Hey everyone, it's Dr. Jay Bowen, and I'm a board-certified physiatrist who focuses on orthopedic issues. And today I want to welcome you to our episode 3 in the series called The Good, the Bad, and the Truth about Regenerative Medicine. In the last 2 weeks, I talked about PRP and MFAT, two of the most common procedures that we perform here at NJRI. If you haven't seen these videos, make sure to check them out as well as our series on knee injuries. Additionally, make sure to subscribe to our channel and make sure you don't miss any of our content. This week I'm going to be talking about bone marrow aspirate concentrate, or BMAC for short. Can you tell we love our acronyms here? First, I'm going to explain what the procedure is, then I'll share with you the good and the bad of the procedure. So alright, let's get into it. When I mention BMAC to my patients, most of it have never heard of it. The procedure involves taking your bone marrow and utilizing its regenerative powers from the bone marrow to help you heal. Think of this procedure similar to a greater version or some supercharged PRP. During the procedure, we use a needle to extract bone marrow from your pelvis, near your buttocks, on the back side. We use local anesthetic and a medication to help you relax and only take a small amount of the bone marrow. Although hearing bone marrow extraction can be scary, I promise, this is not as invasive a procedure or painful as you think. After we collect the bone marrow, we process it in our lab room. The aspirated bone marrow is processed in a centrifuge to separate out the layers and concentrate the cells. And then we can use these and the regenerative factors associated to make a solution known as BMAC, or bone marrow aspirate concentrate. Once the BMAC is ready, I inject it with guidance into the area needing the treatment. Like all the procedures I've talked about so far in this series, BMAC is powerful because it releases your intrinsic ability to heal. BMAC is most helpful in more severe injuries, such as loss of joint cartilage that you know is arthritis. This is an option, and if you're too thin to use the fat, an alternative. The development and use of BMAC in regenerative medicine has evolved over several decades, drawing on its advances in cell biology, orthopedics, and regenerative therapies. It all started in 1956 when the first successful bone marrow transplants for treating leukemia were done in New York. This laid the groundwork for exploring other uses of bone marrow cells. Throughout the 60s, doctors and scientists spent time researching the power of stem cells. In the last 30 years, techniques for aspirating bone marrow and concentrating its components have begun to improve. Researchers began to explore the use of concentrated bone marrow aspirate in orthopedics and regenerative medicine, focusing on its potential to enhance healing and repair injured tissues. The use of bone marrow in regenerative medicine gained traction as clinical studies demonstrated its potential benefits for treating conditions such as osteoarthritis, significant tendon issues, and cartilage damage. Advances in processing technologies and including more efficient centrifugation methods and improving understanding of the cell biology have enhanced the yield of bone marrow aspirate concentrate for these treatments. Ongoing clinical trials and research continue to investigate the efficacy of BMAC for various conditions, refine the protocols, and establish best practices. Since BMAC, like other regenerative procedures, are still relatively new, this is another area where the data collected by Data Biologics is of utmost value. As our research improves, so will our treatment techniques and overall clinical outcomes. Alright, now let's dive into the good, the bad, and the truth about BMAC. The good. One of the biggest advantages about BMAC is its ability to leverage your body's own healing power, and it comes from you and goes back to you. Because we use your own bone marrow, there's no risk of this rejection and there's minimal adverse reactions. The cells and the regenerative factors in BMAC can help accelerate healing, reduce pain, and improve function in the areas like joints, tendons, and cartilage. For athletes or active individuals, this can mean a quicker recovery and faster return to the activities you love. Another significant benefit is the minimally invasive nature of the procedure. Compared to traditional surgical options, BMAC is less invasive, even though it doesn't really sound like it and it seems a bit scary, but it often only takes a brief outpatient procedure in our office and relatively quick recovery time. This can be especially appealing for those looking to avoid more invasive treatments. However, like any medical procedure, BMAC has its limitations. One of the main concerns is that its effectiveness can vary from patient to patient. While many experience significant improvement, others may not see the same level of benefit. This variability can be influenced by many factors, such as the severity of the disease, the area being treated, and individual patient factors. Additionally, while the procedure itself is minimally invasive, it still carries some risks, including infection, bleeding, fracture, or discomfort at the site of bone marrow extraction. Although these risks are generally low, they are important to consider. The truth about BMAC is that while it's a promising and exciting option, it's not a one-size-fits-all solution. Ongoing research is crucial to fully understand its potential and optimize its use. It's essential for patients to have realistic expectations and discuss their specific condition and treatment goals with their healthcare provider. BMAC is usually reserved for more severe pathology, while things like prolotherapy, prolozone, or PRP can be more appropriate for lesser disease or even first-line treatments. At times, we will combine these treatments. Depending on the changes in the bone from arthritic joint, I may consider placing that PRP in the bone below the cartilage defect, while BMAC then goes into the joint. At NGRI, we're committed to providing the best care and using the most effective treatments available. BMAC can be a powerful tool in the right circumstances, but it's important to approach it with a clear understanding of what it can and cannot do. In summary, BMAC offers a unique approach to enhancing the body's natural healing processes, particularly for more severe injuries. It has its advantages such as leveraging your own intrinsic ability to heal and being minimally invasive. However, its effectiveness can vary, and there are risks to consider. As always, it's important to have a detailed conversation with your healthcare provider to determine if BMAC is the right choice for you. Feel free to give our office a call if you believe that BMAC might be a right choice for you. My team and I would be honored to have the opportunity to evaluate you and propose a treatment plan to get you back to doing what you love. Thanks for tuning into this episode of The Good, the Bad, and the Truth about Regenerative Medicine. If you found this information helpful, don't forget to like, share, and subscribe to our channel. You can also follow us on various socials outlets such as X, Facebook, Instagram, and TikTok. All of these are linked in the comment section below, so stay tuned for our next episode where we'll explore another cutting-edge treatment in regenerative medicine. Until then, stay healthy and active.